Hello students, today our lecture about protein energy malnutrition. Protein energy malnutrition is an elementary dependent condition caused by predominant protein and or energy starvation of sufficient duration or intensity. Protein energy malnutrition manifests itself as a complex disorder of homeostasis in the form of changes in the basic metabolic processes, for example, water electrolyte imbalance, changes in body composition, disturbance in nervous regulation, endocrine imbalance, and etc. things. Protein energy deficiency causes a significant delay in the physical and neuropsychic development of the child, and the disturbances in immunological reactivity and food tolerance occur. So what is the causes of protein energy deficiency? We divide these causes two types. First one, congenital, which include maternal, placental, and postplacental, and acquired, which include exogenous and endogenous factors. So let's start from maternal or preplacental causes. This is insufficient nutrition of the pregnant woman, age of the mother, or chronic disease of the mother, or severe gystosis of the second half of pregnancy, smoking, drug addiction, alcohol, infectious disease, and etc. So second type of congenital causes is placental, which include infractions, vascular thrombosis, placental fibrosis, and abnormalities of placental attachment. Third one of congenital causes is postplacental, which include genomic and chromosomal mutations, multiple pregnancies, congenital malformations, intrauterine infection, and hereditary factors like chromosomal disease, autosomal dominant predispositions to malnutrition. Now we will see these acquired causes, exogenous factors. These include alimentary factors, infectious factors, toxic factors, and violations of the regime defects in the child care. Endogenous causes include perinatal encephalopathies, congenital malformations, anomalies, malabsorption syndrome, immunodeficiency states, hereditary metabolic disorders, and constitutional anomalies or their diseases. So, what is the classification of protein energy deficiency? By time occurrence, we divide two types, congenital and acquired. By etiology, we divide alimentary, infectious, defects in the regime, prenatal factors, and hereditary pathology and congenital development anomalies. So, what is this acute protein energy deficiency? This is manifested mainly by weight loss and weight deficit in relation to the accepted body weight for height. Chronic manifested not only by a deficit in body weight but also by a significant delay in physical development. So here you can see 3 degrees of protein deficiency. First degree, this we call mild, and weight deficiency would be 11-20%. Second degree moderate type weight deficiency would be 21-30%. And third degree severe type weight deficiency would be more than 30%. In this picture, you can see the child with first degree of protein deficiency. And in this case, we can see only in the cheek side, subcutaneous fat tissue is less than normal. This is picture of second degree protein deficiency. Already in this case, weight deficiency would be 21-30%, and the Churitsky index would be 1 to 10. This is third degree of protein deficiency. Weight deficiency would be more than 30%, and here would be a lot of disorder, which is we find in the inner organs also, and another disease also would be like rickets or iron deficiency or another infection disease. So periods include initial, progression, stabilization, and recovery. So now we will start the clinical symptoms. It would be by syndromes. First one is undernutrition syndrome. It would be thinning of the subcutaneous fat tissue, body mass deficit, and body proportionality disorder, and flat weight gain curve trophic changes in the skin. Trophic disorder syndrome include thinning of muscles, decreased tissue turgor, and signs which is shown to us polyhypovitaminosis. Food intolerance syndrome, it is loss of appetite up to anorexia, flattening abnormal type of weight curve, development of dyspeptic disorder, decrease in secretory and enzymatic functions, and dysbacteriosis. Central nervous system dysfunction syndrome include disturbance of emotional tone and behavior, low activity, predominance of negative emotions, disturbance of sleep and thermoregulation problem, delay in psychomotor development, and muscular hypodystonia. In this picture, you can see and compare all 3 degrees of protein deficiency. In addition to body length and weight, when studying anthropometric indicators in children, they evaluate head, chest, abdomen, shoulder, hip circumference, and etc. things. So diagnostic of protein energy malnutrition is anamnesis, first of all, data, clinical manifestation, then anthropometric parameters like circumference, head circumferences, weight, height, and chest circumferences, and data from laboratory research methods. Also, we can check the blood, which show to us these all changes. Complexity of therapy include correction of elimination of the causes hypertrophy. First of all, we should eliminate the cause, then diet therapy, then organization of a rational regime, care, education, massage, and gymnastics, treatment of foci of infection, treatment of rickets, anemia, and other complications. Then fermented therapy, like creon, pancreatine, and etc. Drugs, vitamins, microelements, metabolic therapy, pre and probiotics, and stimulating and symptomatic treatment, massage, and gymnastics.